Facelift surgery is one of a popular procedure that we do here also at Signature Plastic Surgery. A facelift is basically a removal of skin and tightening of the muscle of the face. At Signature Plastic Surgery, we'll have you come in for the consultation. You'll meet with Veronica, who will go through your medical history and make sure all your questions are answered. Once that's done, you'll meet with me and I'll sit down and talk to you about your expectations from a facelift. Once I've kind of gotten a good understanding of your expectations, we'll do a brief examination not only of your face, but we'll look at your eyes, we'll look at your nose, and we'll look at the skin quality, which is the foundation for anything that we do on the face. I get many questions about facelifts. The first question I get is, where will the incision be? There are many variations on the incision. The incision can be here in front of your ear, down and around your ear, or in your hairline. The incision can also be in front of the hairline, and it can be short just in front of your ear. I also get questions about, well, will the facelift improve my eyelids or my cheek? The power of the facelift is mainly in the jaw area, where I actually get underneath the skin after I've made my incision, tighten the muscles of the jaw, and remove any excess skin that is required. A lot of times patients have problems in their neck that need to be addressed in addition to the facelift. A lot of times liposuction can be done, or tightening of the muscles of the neck to improve that contour. Lastly, in the same area, we can also look at the eyelids. The facelift does not address the eyelids. And at the same time, I can also do an eyelid lift. So the power of the facelift is really in the jaw area. Another common question is, hey doc, I'm 30 years old. Do I really need a facelift? Well, it depends. If you have some mild jawling, we can make an incision and only tighten skin. The longevity of that facelift is not as long as a traditional facelift where we also tighten muscle, but we can make improvements by just tightening the skin. We can also use other things to adjunctively help your face. We can improve the quality of face through facial peels, chemical peels, and generalized skin treatment. During the consultation process, I pose questions to patients just like they pose questions to me. A question that I must know the answer to, honestly, is the patient's smoking history. This is not to condemn the patient. This is only to provide patient safety. Smoking, as we all know, is detrimental to our overall health, but specifically for facelift surgery, is detrimental to the surgery. Smoking reduces the circulation to the healing incisions. If one smokes during a facelift surgery, those incisions will heal poorly, if at all, leaving us with disfiguring scars and wounds of the face. So, if a patient's typically a smoker and desires a facelift and is physically a candidate for a facelift, we have two options. First and foremost, if the patient does not want to quit smoking, then they don't get treated by us at Signature Plastic Surgery. That's for the patient's own safety. Secondly, if the patient is a candidate and desires facelift surgery, smoking cessation programs in conjunction with their primary care physician have been very effective. We monitor their smoking cessation through laboratory tests to make sure that there are no nicotine products prior to surgery. If during that program we find that they happen to have nicotine products through lab tests, then the surgery will not be performed. Again, just because we can do it doesn't mean we should do it. And here at Signature Plastic Surgery, we're interested in your safety.